Welcome to the deep dive. Today, we're looking at a really quite troubling situation, actually.
Yes, we are. We've got some information from a transcript from The Ring of Fire over on YouTube.
Right. And this deep dive is all about a recent decision, one that directly impacts efforts to protect pregnant women from domestic violence.
Statistically, we're going to get into the cancellation of a grant from the National Institutes of Health, the NIH. And this grant had a very clear purpose: preventing domestic violence against pregnant women.
And the context here is, well, it's pretty stark. The source material really highlights that homicide by an abusive partner is actually the leading cause of death among pregnant and postpartum women here in the U.S.
That's a shocking statistic.
It really is. Think about that. According to this info, women during this time, pregnancy and postpartum, are more than twice as likely to be murdered than to die from other serious complications related to pregnancy.
That statistic alone really just underscores why, research and prevention in this area are so incredibly vital. So yeah, the cancellation of a grant specifically targeting this, it definitely warrants a closer look.
Okay, so let's try and understand the why behind this.
Yeah.
The YouTube transcript states that the cancellation of this NIH grant was attributed to concerns about DEI. That's diversity, equity, and inclusion.
Right. And just for clarity, DEI in research, generally aims to make sure study populations are diverse, and it considers fairness and inclusion in how research is actually designed and carried out.
So what was the specific reasoning given here?
Well, the communication sent to the NIH, and this is quoted directly in the source, said, so-called diversity, equity, and inclusion D studies are often used to support unlawful discrimination on the basis of race and other protected characteristics which harms the health of Americans. Therefore, it is the policy of NIH not to prioritize such research programs.
Okay, so that's the stated policy concern. But what was this grant actually for? It wasn't just theoretical, right?
No, not at all. This grant was for a very practical 2-year project. The idea was to create a training program for clinicians, specifically those early in their careers,
Training them on what?
on how to measure intimate partner violence during pregnancy.
Well,
The transcript goes into a bit more detail. It says the goal was really to equip people like OBGYNs, public health researchers, other clinicians, give them the skills to better spot and assess the link between domestic violence and pregnancy. It was planned as a 3-day hybrid training. So really practical skills.
and getting a grant like this isn't easy, I imagine.
Oh, definitely not. The source mentions that hundreds of hours went into this, from the researchers, scientists, even NIH staff involved in the review process. It's a significant undertaking to secure funding like this.
So a lot of work, a practical goal aimed at a serious problem. And
And then, according to the source, it was terminated immediately.
immediately,
Yeah.
not suspended.
No, that's what the source points out as notable. Not the standard temporary suspension where maybe changes could be made. It was outright termination.
And the reason given for that immediacy.
The reason provided, as per the transcript, was that no modification of the project could align the project with agency priorities. Essentially, it was deemed fundamentally incompatible.
So let's just pause there. We have the administration citing concerns about DEI potentially leading to discrimination in research funding.
Right, that's the official line quoted.
And at the same time, a program specifically designed to help clinicians address what the source identifies as the leading cause of death for pregnant and postpartum women. That program is cut because it can't align with agency priorities.
The source material definitely presents that as a stark contrast, yes.
The source, The Ring of Fire, also includes some commentary, doesn't it? Offering a perspective on this.
It does. It includes commentary suggesting a viewpoint that while the administration might focus heavily on preventing abortion, there seems to be, from this perspective, less urgency shown towards addressing violence against women who are already pregnant.
Okay, and just to be clear, we're reporting the perspective presented in the source material here.
Exactly. We're relaying the arguments and viewpoints found in the transcript we're examining.
But it does raise a pretty significant question, doesn't it? One for our listeners to really think about.
Definitely.
When a program aiming to understand and ultimately prevent the leading cause of death for pregnant individuals is deemed misaligned with agency priorities, apparently due to these DEI concerns, what does that signal about the priorities themselves?
It really pushes you to consider the different forces at play, the stated concerns about research principles versus the urgent need to protect a vulnerable group from a known major threat. What are the implications when those things clash?
Exactly. It leaves you wondering what these kinds of decisions reveal about what's truly being prioritized when it comes to the health, the safety, the very lives of pregnant people in the country. Something to consider.
Indeed.
Thanks for taking this deep dive with us today.